you measure HbA1c for the client. Okay. Now in 3 months, if it is not happening, so ask the client, are you following what I have told you? If the client says no, then you have only two questions. Are you going to follow what I told you to follow now? If the client says no, I cannot follow all those things. I cannot follow all those things, then you need to start the medicines. Because that cannot, the diagnosis is you cannot manage any longer with your lifestyle changes, which includes your stress, your marriage, your food, your exercise, all those things. And you don't want to manage that. So you start taking medicines. Now, I ask you one interesting question. There are two patients. Patient A. Now, what are the complications of diabetes? Everyone is going to land up in angiopathy. Yeah. Angiopathy means the small capillaries, they are going to get damaged. This capillaries may be in the eye, in the brain, or kidney. Correct? So they are going to get damaged. It means either they will develop nephropathy, retinopathy, or some damage in the brain. So angiopathy. So this diabetes is going to lead to angiopathy. Now you have two clients. One client who is taking the medicine and the glucose level is under control. Another client who is not taking the medicine and the glucose level is under control. Which one of this will have more chances of angiopathy? Early angiopathy. So the client who is on the medicines and still control will still develop the angiopathy. Now you understand the significance. Okay, when you say that no, you should first try managing with your lifestyle changes and on your own without medicines. This is the reason. Because your 5 years will get added, probably 10 years. Yeah. Now take another example. There are two clients. One client taking the medicine and glucose is under control. There is another client taking the medicine and glucose fluctuation, not so controlled. Who will develop relatively early or more aggressive angiopathy? Taking the medicine under control, taking the medicine not under control. There are two clients. This time there are two different sets of clients. Both are taking medicines. But one client taking the medicine and blood glucose is under control. The another client taking the medicine not under control. So who is more likely to develop angiopathy? Taking medicine not control, everyone answer? Wrong answer. There is no difference. Statistically significant, there is no difference. What is the meaning of this? There are two meanings. Number one, if you have a diabetes at a level which requires you to take medicines, it means inherently you have certain conditions in your body which will lead to angiopathy, irrespective you control your diabetes or not. Irrespective you take medicine or not. You are a hopeless problem. You understand? Yeah. So you needed medicine not only because of your diabetes, but you have certain condition. Now, presently, there is no medicine to prevent or delay this angiopathy. You can control your diabetes, but you cannot delay this angiopathy. Now, there is another client who asks interesting question. If I'm not going to get benefit in angiopathy, should I not take medicines? And should I continue having uncontrolled blood glucose? No. So there is another client, two sets of client. One client taking the medicine under control or less control. Yeah. Obviously, someone is taking the medicine, they will increase the dose, visit the doctor and try to control it. Obviously. Yeah. That's why taking the medicine under control, without control. There is another client not taking medicine, not controlled. Obviously, this person will more likely die early. Right? Not because they are not taking the medicine, but because they have more fluctuation in glucose. What is the problem in fluctuation? What is the problem? When you are a child, when you are young, what is the color of your cartilage? Little white. As you grow older, it becomes yellow. As you age, it becomes brown. It is happening with every organ of your body. This aging is happening because in every organ of your body. This aging is happening because of glycation. This aging is happening because of glucose spikes, right? It's like you are frying your body in the glucose. So every time you have a glucose spike, you are frying up your body. I will tell you the one experiment, simple experiment. Tomorrow, now tonight you will eat whatever you want to eat. And tomorrow, your first meal, first breakfast, must be sweets. Everything sweets. Yeah, whatever sweet you like, including cake and all those things. And see how you feel. You will feel there is your circuit is short circuit you will feel in the brain. You will feel that sudden glycation of your brain has happened, that you cannot think, you cannot do your work, your thought process will stop, right? Your capacity to do certain work will stop. You will feel drowsy. Hey, you have eaten glucose, but why you are feeling drowsy? Because your brain short circuited because of high glucose content. Another day you do this experiment. You start your day with a savory breakfast where you eat some namkeen, poha, upma, dosa, idli, all those things, right? Which doesn't cause high glucose spike. And this day you are not having your sugar-free tea because it has milk. Yeah. So you are having a tea without milk. You will feel energetic that day. Because since you do not have a glucose spike, there is no big fall. Because there is a gradual rise, this rise will continue over the time and this will give you energy to do your work throughout the day. And because there is no glucose spike, the brain is not short circuited. You understand? So this is a problem. So if someone is not controlled for diabetes, they will die early. All those medical factors are going to be there. Yeah. If someone has less control on the diabetes, then they will have more chances of heart disease, then wound repair will not happen, all those things. Yeah. But inherently, the disease has the capacity to cause angiopathy. That's why, sir, you need to control. Okay. If you want, see, if you take medicines and under control, you will have less 5 years from your life. You are not going to be normal, as compared to the normal person. Yeah. If you do not take medicines and have no control, you will have 10 less years. If you do not take medicine and still under control, it means two things. You are able to control it without medicines with your diet and lifestyle changes, and your disease is not so much advanced, so much progressive that you need medicines. In this case also, both the cases, you will have 2 years less. But yes, 2 years are less, still less. At least you are saving 3 years or 7 years. So you decide how many years you want to save. Are you now convinced? Write down in the chat. To try to control your diabetes with your lifestyle changes. Because it is giving you 3 years. If you care for 3 years, then yes. If you don't care for 3 years, then what to do? Because you don't have a mission or purpose in your life except fighting with your spouse and nothing else and troubling people and all. So when you're talking to the client, tell them the physiology, tell them the mechanism, tell them the benefit. Not in terms of, so if you don't eat sugar, your glucose will get control. Yeah, how does it matter, madam? I am living my life happy. When I have more glucose, I feel happy, ma'am. What is your problem? I don't have any problem. You will die early. You will die early. That is your problem. So you saw the regular calculator, the regulator. So you remember the calculator which we use to find out how likely you are going to die in next 5 years, 10 years. Yeah, you will get that calculator. Don't worry. So in that, diabetes was one of the predisposing factor. So 4% changes when you have diabetes. Whether it is controlled or not controlled, doesn't matter. The question does not ask you whether your diabetes is controlled or not controlled, whether you are medicine or not medicine. It doesn't ask you. It asks you, you have diabetes. If you have diabetes, 4% increases. Just death by because of heart attack or brain stroke. That is better actually. Who feels that the death because of brain stroke or you don't need to use brain stroke or heart attack is better than uh, the following illness or being bedridden because of that? Yeah, and asking people surrounding you take care of you and dragging the whole body. I will tell you the story around this. Yeah, write down what is your preference, how you would like to go. Sudden death, gradual death. Write down that gradual death is, yeah, write down which death you want to prefer. If Yamraj comes to you and asks today, hey, you are going to die after this time, around 100 years future. No, for you 10 years. Yeah. Okay. Diabetes, 5 years. Yeah. So whatever is your, okay, married, 1 year only left. So whatever is your, okay, you are a monster. So monster lives longer. Yeah. So the bad people, today, in psychology class, I was talking about this. All those monsters and these bad people, they live longer, and good people, they go early. So I explained the mechanism of psychology, the immune system and all those cancers, the trapping of emotional trauma. So, but okay, come to the point. What was the point? I forgot actually. Okay. Point is sudden death versus gradual death. Yeah. So I will tell you the story, interesting story. And first drink water. So, and by the time I drink water, I forget the story. You have to remind me. Don't forget that I'm going to do something. ADHD, it happens this thing. So you start something, then you don't know what you're doing. Yeah. Those who are not writing sudden, I'm assuming they prefer gradual death. Okay, you will get the gradual, slow death. This is a true story. There are few learnings from the story. And for today's topic, the story learning is the sudden death. But there are other learning also, the willpower and all those things. True story. So my father had a heart attack during Corona time. Yeah, the first heart attack. And he underwent angioplasty. That angioplasty did not work. Right? Because we went to the hospital late because of Corona, fear of Corona infection. He was admitted for 1 month, and I was there at the hospital 30 days. Suddenly, my fear of Corona had gone. uh, I don't know. So, but thankfully, I didn't contract it. And by the time he was discharged after 1 month, doctor said that he cannot walk, he cannot climb stairs, and he will be dependent. Okay, because ejection fraction is 20%. Normal ejection fraction of heart is around 45%. So 50% damage is done, right? So maybe 40% heart is functioning now. Okay. So and we came home. I arranged the ICU at the home, the nurse, the doctor visiting, and all the bed, the monitor, all the oxygen, and all the nebulizer, all those things. Yeah, which son has to supposed to a doctor son supposed to do. Arrange the ICU, same ICU, because we don't want to stay longer at the hospital. And then one day my father called me and he said that remove all these things. I'm like, what is a plan? Like, what is a plan? Like, do you intend to say goodbye? So I asked him, do you want to say goodbye? I said, no, stupid. I'm feeling better. So and then we removed all those things. Then we had a two-floor house where he lives, used to live. So he was living at the downstairs, yeah, ground floor. Then after 1 week, he called and said that, yeah, I'm shifting to my room on the first floor. I'm, okay. I'm like, yes, okay. So doctor has said he cannot walk, but my father said he will shift to his own room, downstairs, upstairs, walk the stairs at least 4 times in a day. Because in the morning he has to go for the walk. Yeah, he decided to go for the garden walk, continue for the garden walk. Yeah. So then one time for some office was downstairs, so office work, then sometime else. So 3-4 times daily. Now few months later, he visited the doctor. Doctor asked, how is your health? He says, I'm fantastic. So are you still like able to walk? He said, yeah, I'm actually climbing the stairs 4 times in a day and walk 5 kilometers in a day. The doctor is very impressed. Yeah. Then there comes a second heart attack. Now, the second heart attack, the story is that he's alone in the market, and suddenly he had probably arrhythmia and he went unconscious. And people are surrounding, how it happens in the market. Like people are like, oh, what happened? What happened? Everyone's like, but somehow his phone pocket dialed me. Yeah, I got a pocket dial from my father's call number, and I answered that phone, and I realized there is something wrong. So I always have a protocol that I will always answer few calls, even if I'm in busy. So I realized something wrong. Then I called back that number, and then someone else answered the phone, and he said that "Jinka ye phone hai, the phone who's this person is unconscious and lying at this place." Then I called my brother and said I was in Mumbai that time. So I called my brother and said that you go there, yeah, and try to do CPR and all those things. So CPR done, revived, came back home. And next day we thought, okay, should we visit a doctor? He said, I'm feeling good. Okay. Any chest pain, anything, any problem, any symptoms? Are you able to walk stairs? That is a factor. So are you, how many kilometers you walk today in the garden? 5. Okay, good. No need to go. Forget. Then 2 years pass by. 2 years, huh? So doctor has said 6 months patient will not live. 2 years patient is still walking and going. Now, so this was second. The third heart attack. Now, the third attack is again that arrhythmia. So here the risk of sudden death. Yeah, arrhythmia. And now third heart attack was again 1 month we were admitted to hospital. So the doctor says now I think the time has come for the implant. Yeah. So we put the intercostal defibrillator, whatever. Yeah. ICD intercostal. So there is a defibrillator. Normally, what you do when you have arrhythmia, you give a shock externally to the patient. Yeah. But now the patient may be outside. Yeah. The shock you can give at hospital only or homemade ICU. So so there is a device which is implanted near the heart, under the chest muscles. It detects the arrhythmia. If the patient has arrhythmia, it will give the shock. So that device is to be ordered from US. So I said, okay, go ahead, no problem. So they ordered the device and everything and all those things. But my father was weak. Okay. So physically he was weak. So I was okay, everything. And but the doctor said that it's very costly device. I said, sir, I can buy your hospital actually. So don't worry about the cost of the device. Get that device from wherever you want and get the best company. So the device came, and by 11 p.m., I thought, okay, I should do the research on what this surgery is there. Then I saw that, oh, this surgery is a big surgery. Then I called doctor, sir, I want to meet you. Please come now. So he was kind enough to come in the middle of 11 p.m., middle of the night. And he explained me that we are going to open his chest and do this and create a pocket and then put that device. I was like, no, he is not going to tolerate that. Yeah, and the doctor is like, no, 1 week in the hospital, 1 month at home care in your home ICU, homemade ICU, and he will be good. I said, no, 1 month can be 3 months also bedridden. No, I will choose sudden death. See, life and death, they are already written. So 6 months after this episode, he went away. He departed. My father passed away. If I would have gone for that implant, it would have been a gradual death. He would have been bedridden for 3 months, 4 months, probably 6 months, dependent. Yeah. And this defibrillator, what would have done? It would have probably just prevented arrhythmia or treated arrhythmia. But inherent disease is there. Yeah. Heart is not functioning, heart failure is there. Many things. Old age is there, 72, 74, 74 now. So I decided, I told the doctor, I would prefer a sudden death for my father. He said, we have not seen any son talking like this. Yeah, people get emotional. They sell their jewelry, they sell their lands to save their old parents, and the parents then die and they don't have anything. I said, no, it's not about the money. Obviously, you also know me. It's about what kind of life you want to give to your parents. What kind of life I would prefer for me. Yeah. So I prefer sudden death for my father. Then I went to my father and told him that I have decided on this. My father said, okay, fine. And then one day, after 6 months, I got a call. Father passed away. Sudden death. So the day he passed away, he went to the garden, he met his friends, he went to buy vegetables, he climbed downstairs. He was not bedridden on his in his room or downstairs room for one day also. Probably ICD may have extended life by 1 month or 2 months. But if you consider life and death, they are written when it was not extension. Yeah, that's not the quality of life you want. Sometimes some clients call me and they ask the opinion that, sir, 72, 70 age parents, they have been diagnosed with cancer, blood cancer. What should we do? They are trying for everything. They spend money. Yeah. They do some test, fish test, that test, that test. And they try to find out that what is the type of blood cancer is there. What is the objective? You spend 1 lakh rupee just to find out a diagnosis. Yeah. What is the objective? Then you will start chemo. That 72-year person. And this chemo can itself kill him or her. And people sell their house, gold, everything, all savings. No, the correct decision is to bring that patient home. Say goodbye at home. It will take 15 days, 20 days, 1 month. But the patient will not die of the guilt. That patient consumed the whole property of the family and died. The death is imminent. With any medicine, any treatment, you can extend it by 6 months to 1 year. The time has come to prepare yourself for the death. Come home, say goodbye. This is a true story again. Huh? Now the difficulty comes when someone is young. I had one of my employee, 35 years, a female, she developed blood cancer, acute lymphocytic leukemia. Husband came to me, she was on leave. Husband came to me, asked for some money. I gave 50, 60,000 because that was their expense for diagnosis. So confirm the diagnosis, that is important. Husband came to me with the report. Asked me, sir, what should I do? I said, my company medical insurance will cover 5 lakhs. You will have another expense of around 15, 20 lakhs. And she will die a painful death in next 1.5 years, 2 years. With all the chemo, all the harassment you are going to do, take her to Mumbai, take her to this, take her to this place, take her to that place. What do you want to do? She had a child. Nothing can be done. Now he was like, sir, I will sell the house and all. So I said, that is your choice. But you have to think that will not prolong her life beyond certain point. 1 year, 1.5 years, 2 years. The tough decision you will have to take. Whether to say goodbye at home or to spend all your earnings and make her painful death. And she will die of the guilt that she destabilized you financially before death. So that is a tough. Yeah, if it is old age, the choice is very easy. It's not being about heartless or with heart. It's not about being emotions or practical. It's about what is best for the quality of life. If you control your diabetes, your quality of life will be better. That's the only thing. The last 5 years, last 3 years will be better for you. Hey, you are going to die at the age of 65, 70 or whatever. But last 5 years, do you want to live with brain stroke, heart disease, kidney failure, that failure and all those things? Or you want to delay it and just suffer last 2 years? Suffering is there. You want to reduce it or you want to enjoy it? Now, whenever you lose some, especially your parents, the grief is there. I was mentally prepared since 2 years because I was mentally prepared. I prepared my family that father may go anytime. We are selected sudden death. So anytime he can go. But the death, it causes the grief. And I went under grief, went under breakdown, mental breakdown. Yeah. So then that time in psychotherapy sessions, in Sunday classes, I used to teach certain methods for grief counseling, certain methods to overcome the grief. And I used to say that this is sufficient. But then I realized, no, this is not sufficient. Not sufficient. So there needs some new methods, new research in this. So that's why I am funding a research on grief counseling. You can check the details in griefcounselor.in or griefcounseling.in. Both are the websites for that. Okay. You can check this. So more than 10 hospitals, now more than 15 hospitals, they have participated in this. And we have come out with some new research on this part. Okay. Narayana Bangalore, Air Command Bangalore, Military Hospital Pune, Command Hospital Pune, Medanta, Gurgaon, CK Birla, Gurgaon. Few more hospitals. More than 10 hospitals, they are participating in this research and they are working on this. So my team is working there on this. So especially those who do PhD and all, so they get more benefit out of such research. So we are working on developing new modalities. So coming back to the topic of diabetes. Yeah. Sir, what do you want? Sudden death or painful slow death? If you control your diabetes, if you are able to control your diabetes, more likely you will have a sudden death. I don't know how to put it politely. If you do not take medicines uncontrolled, it will be slow, painful death for long, slow. Yeah, 5 years, 10 years suffering. If you take medicines and if it is under control, then that suffering will reduce for 2 years, 3 years. The choice of medicine, whether to take or not, yeah, it is decided by HbA1c. You will do every 3 months, 3 months. One time you do, you start to work on. You fail, you again do, and you ask the client whether you can do or no. If the client says, yes, I will try, then give it a try. If the client says directly, no, there is no point fooling yourself. The time for medicines has come. You need to understand the basic physiology of diabetes. There can be two physiology. One, the cells in the body, the receptors, they are not working properly. Insulin receptors, they are not working properly. The cells have become resistant to insulin. Insulin is high, but still it is not able to perform its function of the cell. That's why glucose is not entering the cells. Number two, this is easier actually, relatively as compared to insulin deficient. Because if you have the insulin resistance, there are certain things you can do to improvise on this. If you have now insulin deficient, then the choices are very limited. You need to start insulin. Even the medicines will not help. Okay. Because you are insulin deficient, you will continue your insulin. You will do some lifestyle changes, certain things, nutrition, which I will tell you, to maintain your balance of glucose and to have a longer life, healthy life, better quality of life. Because the problem with diabetes is not only the blood glucose, it's because also the heart attack, the stroke, retinopathy, nephropathy, kidney failure, delay in wound healing. Right? There are many things. Then low performance, all those things are going to be there. There is a bigger risk for diabetes. The bigger risk is This, if you have high sugar, high blood glucose, it's not going to kill you immediately today. But if you have low glucose any time of the day, you may fall unconscious. That can happen while you're riding, while you're performing something. You may land up in coma if you have low glucose. You may hit your head when you fall unconscious. So why you need me? Even if you're taking your medicines, even if you're taking your insulin, you need me as a nutritionist and dietitian to help you make your diet plan and charts so that you manage not only your glucose spike, but also prevent falls, but also prevent your hypoglycemic episodes. Otherwise, most of your clients will think, yeah, I'm taking insulin control, done. So you have to emphasize your importance in their life. Even with the medicines. Now, there is a problem with the medicines. There are two problems. One, if it is not controlled, you may need to increase the dose of medicines. Whatever medicines you are taking, it is having side effects. If you increase the dose of the medicine, that side effect will also increase, right? So even if you are taking medicines, you will follow what I am going to tell you. To control your blood glucose, to control your spikes especially. There are two reasons for this. Number one, that you don't want to increase the side effect of medicines by increase the dosage of the medicines. Number two, you want to prolong your life. You want to have a good quality of life. Right? Now, what are those things I'm going to tell you? Before we start that, I will answer this Mira's question. So, can diabetes be completely cured by lifestyle changes? Diabetes is a condition. Your body has it. Someone has cancer. The body has it. The cancer tumors can be removed, the cells can be removed, but slowly after 10 years, 20 years, they will regrow. Again, it will come back. Now, the time they come back may be so long that this person dies gradually or because of some other disease. Right? So when you say cured, it means this disease is not going to affect you, your natural life. Okay? There is another meaning to the cure. By statistical meaning of cure is, now you are cured of your cancer. Your survival for next 10 years is 80%. Means there is a 20% chance you are going to die. Only 20. Yeah. If you do not take the treatment, you will die 90%, 10% survival chance. Now you are cured of the cancer. There is only 80%. Now the survival rate is 80%. Oh, madam, for that person, the survival is 100%. Yes or no? Yeah. For that person, you are saying that 20% likelihood you are going to die in 10 years. But a normal life would have been 30 years. So 10%, 20% chance is that the person will die in next 10 years. It means you also know that it is not completely cured. It is only statistical definition of cure. Yeah. So when someone says diabetes is cured, they do not know the real meaning of cure. The diabetes is under control. Yeah, you want to use that word, I will cure your diabetes for permanently by my lifestyle changes, because that is a marketing tactic. No fight with that. No problem. Continue. But the diabetes will not go. The insulin, pancreas is not going to start secreting your insulin. Yeah, there is nothing like that. Whatever cells they have, they are resistant. They are going to be resistant. Only thing you can do is, if they're resistant 90%, your resistance has decreased to 50%. That thing you can do. Now, inherently, the diabetes is going to cause you angiopathy. So your survival is going to be less, definitely, as compared to other people. Okay. But you can control your diabetes so that your episodes of other diseases or comorbidities, early comorbidities, may be reduced. So marketing tactic, you'd say, I cure your diabetes. The real thing you know is, I control your diabetes. There is no lifestyle change, there is no chemical formula, there is no Ayurveda or any medicine which helps your pancreas to increase the insulin secretion. If your islets of Langerhans is damaged, there is no option. Now we talk about this client where the cells are resistant. Okay. The objective is not this resistance is 90%, I want to bring it to full-fledged sensitive cells. No, that is not my objective. The objective is the resistance is 90%. I want to bring this resistance to 50%. I succeed. Okay. Not that it will reduce your angiopathy, but it will reduce some other episodes. It will reduce early comorbidity. Okay. It will reduce your aging. What are those things? Number one, your marriage and stress. Number one is your stress. Okay, for whatever is your reason. Yeah, you define your reason, whatever is that. Now, for stress management, the easiest and most comfortable way which people can do is breathing. Simple breathe in, breathe out. Simple. Don't use the big word like yoga and all. Everyone is not inclined. Someone who wants to learn yoga, do yoga, they will come to you and say that I want to learn yoga. But a lay person or even educated person or highly motivated person, you say yoga, I don't know, I'm not sure, I don't want to do. Yeah, that's the problem. So they don't know. So instead of using that big word, you can say actually task. So one of the tasks is breathing, simple breathing. So I tell you, there has been a study. There are two sets of people. One set of people, they have rapid breathing, means they have 28, 30 breaths per minute. This set has 18 or less breaths per minute. Whatever is the reason, anxiety and all those things, or exhaust, whatever, habit. This, if someone is breathing rapidly, it means they are breathing shallow. If someone is breathing more, now in this, there can be two subsets again, but we assume that this is breathing deep. So the study found out that those who have less frequency of breaths per minute and those who have deep breaths, and it's not or, and those who have deep breaths, they live longer life as compared to this population. Okay. This population who have rapid breaths and shallow breaths, they die early. How early? 7 years. 7 years. You will increase if you shift your breathing from rapid and shallow to deep and slow. You like this knowledge? To motivate you for breathing deeply and slowly? Read in the chat. Yeah. If you tell someone, hey, breathe slowly. Yeah, I will do it today because I remember your face and cute smile. But tomorrow I go and see my wife and fight. Then I want to breathe faster. Yeah. And then I see my manager and then what you know, I'm hyper breathing. Right. So people forget. But if you tell them this rationale, they are like, yeah, 7 years, 7 years, 7 years. I want to survive 7 more years. So they shift to that. Now, when you go for slow and deep breath, inherently it reduces your stress hormones. Inherently it calms down your heart, calms down your mind. Okay? It will not calm your marriage. Then comes, so this simple one task, breathing. There are two breaths you should know. As a nutritionist, dietitian, two breaths, 1 and 2, right? Dramatic. So first breath is 1, 2, 3, 4. 1, 2, 3, 4. Breathe in, breathe out. So here you will count 1, 2, 3, 4, and client will do that. You will count it slowly. Otherwise, it can be 1, 2, 3, 4, 1, 2, 3, 4. So this is equal breathing. 1, 2, 3, 4, 1, 2, 3, 4. When you are breathing in, instruct the client. Breathe in with nose and your stomach should come out. Many people, they do the reverse breathing and they die early, 7 years. From today onwards, you will be so conscious of your breath, 7 years, yes. Unless you are trapped in such a bad dash that you prefer to die 7 years early. So 1, 2, 3, 4. 1, 2, 3, 4. You breathe in with your nose. Your stomach should come out when you breathe in. Your stomach should go in when you breathe out. Breathe in with nose, breathe out with nose. Some people are like, can I breathe in with nose and breathe out with mouth? Yes, no problem. Can I breathe in with mouth? No. Breathing has to happen with nose. Why? Because when you breathe in with nose, it goes to sinuses and then it goes to lungs. It brings proper temperature, humidity, all those things, and that is more beneficial. Okay, and humans are supposed to breathe with our nose. So do it normal human being. Don't be monster. Don't be animal. Hmm. Don't be like your spouse. The second comes the rectangle breath. Now in the rectangle breath, the width will be bigger, length is short. This is breathe in, breathe out. Now understand the physiology first. So you are breathing in more, you are breathing out less. So when you are breathing out less, you are retaining the carbon dioxide. When you retain the carbon dioxide in the lungs, it goes to blood, it's converted to bicarbonate, and it stimulates your brain for the midbrain, yeah, brainstem. Sorry, brainstem. It stimulates further, which increases your breathing depth. It reduces your respiration rate, heart rate. It excites your vagus nerve. All those stress hormones, corticosteroids, adrenaline, they get reduced. Yeah? Plus, this bicarbonate has more beneficial effect, yeah, which is beyond the scope of our discussion, but it has more beneficial effect in terms of all the organs. So if you do breathe in more, breathe out less. Good. Yeah. So you try doing it with me. Yeah. When I hold this finger, you will breathe in with this, breathe out. Breathe in, breathe out. Again, start, reset. Breathe in, breathe out. Breathe in, breathe out. This breathe out is going to be slow. Don't blow the candles. It has to be slow and gentle. Yeah. You have to feel it here. Breathe in, breathe in, breathe out. You do this 10 times. You can do it wherever you are. And you can tell the client to do that. So start with this. We are talking about holistic diet approach. Then comes your lifestyle changes. Don't tell the client join the gym. Joining the gym does not help you. You have to exercise actually. Yeah. So paying the membership fees doesn't help you, dear. Yeah. Buying the sports shoes doesn't make you lean. You have to run actually. Yeah. So you tell the client you exercise. Now tell me how much you can exercise and can you do that or no? So client will say, no, I cannot exercise. Do you have stairs at your home? Can you climb the stairs? One flight, two flight, whatever is you comfortable every day. Don't use the lift, at least while coming downstairs, even if you are staying on 10th floor. So, the Jaslok Hospital, 18 floors. So when I was working with Pfizer, I used to go every month there. All 18 floors I used to climb. And all the 18 floors used to come. The MR with me, they used to like, sir, lift. I said, no, it's so crowded, I will get infection. It was because before Corona, obviously, long back, 10 years now. And I was like, no, we walk 18 floors. Then 18, you like, okay. So whatever floors you have, you can always walk downstairs. Then you take your walk for the dog. You take your dog for the walk or ask your dog to take you for the walk, whatever you want to do. Yeah. Whomsoever is a dog in that relation, you get it done. Yeah. Take your child for the walk or the garden. If your child is playing, don't sit like an old lady mourning and thinking about your sad life. Play with the child. Whatever the child is playing, run, play, yeah, whatever the child is playing. That is sufficient. You don't need a gym. You don't need exercise. You don't need to buy a gym at home. You don't need to lift weights. Doesn't matter. Start with this. Yeah. Ask your dog to take you for the walk, play with your child, and climb the stairs or at least come downstairs. Whatever you prefer. This is exercise. Another is about the stress, very important, which you should visit a psychology counselor for that. So that's why you should get you should get trained in psychology counseling, and you will learn all the conditions: anxiety, stress, depression, OCD, bipolar disorder, ADHD, personality disorder, monsters in your life, narcissist, hopelessness, loneliness. How to manage this? We don't teach you theories and models of counseling. We teach you actually manage each of these conditions. 6 months program, worth it. Yeah, that investment. In 3, 4 clients, you will recover that fees. Fees is also very less. Book is awesome. Available on Amazon. If you don't want to learn the course, you can buy the book on Amazon. Yeah, I have to show the book there. What are you doing? If you don't want to join the course, you can still read the book. The book is available on Amazon. Practical Psychology Counseling. This talks about how to manage the client, the conversation script between the client and the counselor, how to diagnose them, what are their questions, how to answer, and how to actually counsel the clients for all conditions, including adult, child, and teenage. That's the pain area for you if you're a parent. Thankfully, I'm yet to land up there. Before that, I need to do some research, how to manage a teenage child. You can buy it on Amazon or you can join the program. Then comes about the marriage. There is a book for marriage. Yeah, there is a course also for marriage. But I will recommend not to touch that topic today because there is a more chances that with me something is going to happen after this class. Okay, so then comes about the food. So you will get the worksheets for the diabetes food. You will get the worksheet for diabetes with hypertension, diabetes old age, early onset diabetes. Okay, different worksheets you will get. Okay, diabetes with heart disease you will get. Then you need to educate the client if patient is diabetes, what are the things they should look for? They should look for cut, nicks, and wounds and all those things to heal them. They should look for early symptoms. If it is beyond the middle age, then you should look for other symptoms of heart attack, not the chest pain. You know, the problem with diabetes, it causes angiopathy, so heart attack will happen, but it also causes neuropathy. So nerves are damaged. Now the nerves which transmit the pain signal from heart to your brain, they are damaged. So your brain will not feel that you have the pain. Silent heart attack, diabetes. Yeah. So if you are a diabetic, it is less likely that you will be diagnosed, self-diagnosed. You will diagnose yourself or land up in hospital in a proper time within golden hours for heart attack. It is less likely because you will have silent heart attack. Someone who is non-diabetic, they will feel the pain. If you're diabetic, you will less likely feel the pain. You will feel other symptoms. What are those other symptoms? Ghabrat, anxiety, yeah, then giddiness, sudden sweating, yeah, all the mixture of this. Or you will start feeling breathing difficulty on exertion. You call it weakness on exertion. Many clients say that weakness. Actually, it's breathing difficulty. Then take care of your limbs and all. Do not burn them because you know there is a neuropathy. So if diabetes is uncontrolled, so you will not feel the pain sensations in your legs and arms. So you may bump up on some things. There is a fire. You are not feeling the heat because neuropathy, and you are not feeling the pain. So you burn your fingers. Yeah, that happens in diabetic patients. And then wound gets delayed healing. Wound has delayed healing because of angiopathy. It is problem. That's why you need me. You need to visit me every week, every month, and take my consultations because it's not about the lifestyle changes. It's not about the food you eat. It's not about the medicines you take. It's about meeting me, talking to me, listening to me that heals your diabetes. And the fastest mode, if you want to heal your diabetes, is attend the classes with video on. Remember, the nutrition dietetic clients, they are not going to come you for a piece of paper. You tear away the paper and give them on their head and tell them you follow this. That is a poor nutritionist. She will never earn money. She is earning same money as a Domino's person. Delivery boy. If you want to be rich in nutrition dietetics, learn to engage the client, learn to explain the client the physiology, what you have learned from me. Learn to explain the client why they need to do this. If you're telling them eat fibers, why? You will live longer. You will have a better quality of life. Explain them all the stories. Yeah. Today you got convinced that you want to breathe deep. If I told you, if someone had told you, you should breathe deeply, you forgot actually that thing. That's the thing. Yeah. But today, this will haunt you forever. 7 years, 7 years, 7 years, 7 years, 7 years, 7 years, 7 years. Yeah. Question anyone has? We can take the class as long as we want. I have that capacity. I'm thinking of you, the poor fellows, the poor fellowies who have some people surrounding them, waiting for them. Mama, what are you doing in the clinic? Come with me. I want to play. I want to go out. And you're like, hey, get out from the camera. What is the problem, Darshana? If the child comes in the camera, what is your problem? It's okay. Let the child also learn. Don't be so selfish. If my child says, Papa, time to go, I'm like, switch off the immediately. Immediate switch off, immediate go. No problem. Gayatri has asked an interesting question. We'll end this with this question. Anyone has any question? Write down in the chat before I complete this answer. So you are thinking, sir, everything is blank, so not getting any question, not getting any answer. Okay. So urine glucose levels increase. What is the reason? I think Gayatri, you need to learn English. Number one, grammar is mistake. So rearrange the word. The meaning becomes, what is the reason for urine glucose level increase? Urine glucose level. So you know you have glucose in your blood, okay, but it is not excreted in the urine because the kidney, the nephrons, the cells in the kidney, they are not allowing glucose to filter out. There is a filter. This filter can remove urea, remove some small molecules, but glucose is a big molecule. So it is not getting leaked out in the urine, right? But now, because you have angiopathy, that will lead to your neuropathy. So neurons will get damaged. Now, because neurons are damaged, it will leak out certain things. These certain things will be bigger molecules, which will include glucose as well as proteins also. Right? Now, there is a two problem. One is your glucose is high that it is leaking in the urine. Plus, there is a damage in the nephrons. That's why glucose is leaked out. If you have high blood glucose, but urine is negative for glucose, okay, Baba, nephropathy has not happened. But irrespective of glucose level, because it is controlled or not, you have glucose in the urine. You have proteins in the urine. Not good. The nephropathy has started. 10 years, 15 years gone. You want to prevent that? You want to prevent that? Come to me every week. Yeah, listen to my pravachan, follow what I tell you, then you will have only 5 years gone. Yeah. I'm not telling you 15 years saved because I don't want to be lying. Yeah, I am very truthful. So following my advice will add 10, will prevent you loss of 15, only lose 5 years. If someone is telling you they will give you 15 more years, don't trust them. They are just marketing tactic. I'm a sincere nutritionist and dietitian. I give only real advice. Engage the client for 10 sessions, 20 sessions, yeah, lifetime. But obviously not in an ethical way. Yeah, the client likes you so much that they come to you not because of they want some advice. They come to you for some excuse. Ma'am, today I got the report. I just wanted to meet you and show it to you. Wow, I love you so much. You came to meet me. Thank you. Obviously, you have paid the fees. Yeah. So, and they want to listen to you talking about their report, which is not related to you. Yeah, because no one has explained them their blood report, but you are the best nutritionist and dietitian. You know how to explain one report for 1 hour. You have that capacity, right? How many of you have learned that explanation of physiology, these bad thing, normal thing, why, what? Have you learned that from the classes of lab report? 3 classes we did for lab reports. If you're not learned, there still is a hope because you can watch the recording. Problem solved. You're not going to remember everything in one answer. Yeah? You have to manage 100 clients to remember those things. I do not have count of how many clients I manage. And I tell my counselors, never keep a count of how many people you manage because you have to manage this many clients that you forget how many you've managed, right? I'm paying you this much. So I need this much business. You cannot tell me, sir, I manage 3 clients today. Hey, get out, average Domino's girl. Tell me how much money you brought. And still that is not sufficient. I'm not meeting my target. There is some block I'm facing. I need help actually. So my target is 1 CR per month, but I'm just doing 80 per month only. So 20 is always lacking behind. I'm fighting how to cross that. If I found out, I will tell you or share that story. Yeah. You want to know the story from how much I was getting as a MBBS? 15,000 something to this story. I can share that story in some other class, or maybe when we meet in some offline sessions or something. For psychotherapy students, they come for offline also. You enjoyed the class? What the record was 100 sessions. Okay. The link which I have sent you here, there is one link for watching the recordings. It is there. Since 2 weeks, I have not uploaded because since 2 weeks, I could not take the class. Yes. Okay. Very good. You enjoyed? I also equally enjoyed uh, when I was listening to your questions and you are smiling, cute faces. That's what cheered me up. I also equally enjoyed. So keep smiling because that is the only most important character of a successful nutritionist and dietitian, any consultant. Yeah? If you smile, 50% diseases are gone. If you talk some rubbish, another 50% is gone. Then you don't need to give medicines at all. Yeah. Have a great time. See you then. If you have any question related to exam or anything, any stupid question or any good question, Monday to Friday, 1 to 5 p.m. If you have any emergency after 5 p.m., go to your nearest hospital.